My research is broadly focused on looking at nutraceutical or pharmacological interventions to whether to halt or to prevent the progression of neurological disorders such as Alzheimer's disease, multiple sclerosis, and chemotherapy-induced cognitive decline. My name's Virginie. I am a research fellow based at the Curtin Medical Research Institute at Curtin University, Perth, Western Australia. I'm also a research affiliate at the Perron Institute for Neurological and Translational Science, also based in Perth, Western Australia. I've had a pretty linear pathway for my academic journey. I started off with my undergraduate degree, which was in biomedical science, where I majored in immunology, clinical biochemistry, and transfusion medicine. After that, I did an honours degree for a year. That was really to test the waters, whether I liked research or not. And during my honours years, where it really sparked my interest in neuroscience and nutritional physiology, particularly in relation to Alzheimer's disease. So following my honours degree, I completed a PhD, which took about 5 years, and that's where I looked at the association between vitamin D homeostasis and status in older adults and its role in brain health and cognitive function. So I was very lucky to secure a National Health and Medical Research Council fellowship. That was in 2019. That was where I was able to complete my postdoctoral studies, also at Curtin University, and which is where I'm based now for my research group. My research is on the cusp between preclinical biodiscovery research using animal models and clinical studies using clinical trials. So essentially, my research is broadly focused on looking at nutraceutical or pharmacological interventions to whether to halt or to prevent the progression of neurological disorders such as Alzheimer's disease, multiple sclerosis, and chemotherapy-induced cognitive decline. So a few of the major projects that I'm leading currently, the first one I'll talk about is Alzheimer's disease. So Alzheimer's disease is the most prevalent form of dementia, accounting for about 70% of the cases. There's about 50 million people currently affected by Alzheimer's disease globally, but there is no cure. Despite there's been a lot of therapies that's been a bit hit or miss. So what our group is currently looking at, we're testing a particular drug. It's called Probicol. Essentially, it's got a number of pleiotropic properties where it's a very strong antioxidant, anti-inflammatory, and what's really important is vascular protective as well. So it protects the blood-brain barrier in particular, and that's what we think is one of the major causes for Alzheimer's disease. So we have completed a number of preclinical animal studies to essentially test the efficacy of this compound in a number of animal models of neurodegeneration. And now we've been very, very fortunate to secure funding where we're running a multi-site clinical trial across Australia. So we've got the lead site in Perth, and we've expanded to Hobart through the University of Tasmania, through Adelaide at the Queen Elizabeth Hospital. We're soon to be opening up a site in Brisbane. And our first international site will be lodged in August this year, so 2025, and that will be in Christchurch, New Zealand. So effectively, we're wanting to look at whether this drug Probicol is able to stabilise cognitive function in individuals who have mild to moderate Alzheimer's disease. The second major line of research inquiry in our current group is looking at potential interventions that can prevent chemo brain. So chemo brain is also known as foggy brain. It's essentially a phenotype which occurs in a number of individuals who receive chemotherapy treatment for cancers. Now, it's mostly prevalent in breast cancer patients and survivors. Essentially, the commonly reported symptoms include attention deficits, short-term memory loss, and just loss of ability to perform daily tasks. So quality of life is definitely compromised. So what hasn't been widely investigated is potential interventions that can actually prevent this phenotype from occurring before it actually occurs in a prophylactic context. So using compounds that we have developed in our lab, which have shown neuroprotective properties, we are testing out these particular compounds in animal models of chemo brain. So our group has several different types of animal models of chemo brain. We're essentially providing these compounds before the chemotherapy is given. And we've seen very, very promising results in this context, where we can basically alleviate the cognitive deficits which are seen in chemo brain. So we're currently expanding on these studies to breast cancer animal models. So that is under process probably for the next 6 months or so. But the intention is to be able to relay this to a clinical setting, so be able to test these out in clinical trials. We work with quite a vast network of collaborators across Australia and internationally as well. So I'll name just some of the main organisations that we work with. So the National Imaging Facility, otherwise known as NIF, which has a number of imaging nodes across the major states in Western Australia. We're working with the University of Tasmania, predominantly through the Wicking Dementia Education and Research Centre. We're also collaborating with researchers at the University of Queensland and also through Metro North Health Queensland, and also the Baker Institute in Melbourne. Internationally, focusing on more of my neuroimaging research focuses, we're collaborating with people at the University of Manchester as well as the University College London. My research is predominantly funded through the Australian National Health and Medical Research Council, otherwise known as the NHMRC, also the MRFF, which is the Medical Research Future Fund. A few of the other major organisations that fund my research include the Department of Health Western Australia through the Future Health and Innovation Research Fund, as well as the Bryant Stokes Neurological Fund. We're also very fortunate to receive funding through not-for-profit organisations such as Multiple Sclerosis Western Australia and other philanthropy donations. The passion in my work is mainly driven through the ability to potentially transform the research results that we get from lab bench, so all the foundational research, and able to translate that into real-world clinical practice. So it's to me, it's really important, and it's a massive driver for me that we have this opportunity to potentially change the lives of individuals who are affected by these neurological conditions, as well as their families and their support networks. What else drives my passion in research is working with really like-minded people who are very passionate about their particular research lines of inquiry as well. So I work in a very big multidisciplinary network of researchers, clinicians, trial people, as well as consumer advocates. So that's a major driver for me, being able to work in a really good environment and just enabling us to see bigger picture. I love travelling, and with research comes with a lot of perks as well. We get to travel either nationally or internationally to different conferences to share our research findings and learn from other researchers and clinicians and consumers as well. Part-time, I am a Les Mills group fitness instructor, so I've done that for over 15 years now. I teach about 10 hours of exercise classes a week, which I think keeps me quite sane, obviously keeps me active as well. And I've recently taken on tennis, and I've been quite humbled. It's been very fun, but taking on a new sport as an adult has been very interesting and having a great time.